Tumescent, tumescent assisted sclerotherapy, what it is and what we have learned from it. The basic concept of sclerotherapy, it is to transform a tube into a ribbon, and for that we need compression. It is very easy to explain the tumescent assisted phone sclerotherapy for GSV because it improves occlusion rates in comparison to phone sclerotherapy alone. And there's some techniques description worldwide. One of them described by Dr. Urbanek, who is here with us. And there are several others description of tumescent assisted phone sclerotherapy of right saphenous vein. And this is very easy to explain because the saphenous vein is inside the saphenous compartment between the muscular and the saphenous fascia. And so the liquid, the tumescent liquid, will be very contained by this compartment. But tumescent assisted sclerotherapy for spider veins and reticular veins will say, oh, I do not need it because I use compression stockings. And years ago, back in 1999, there was a paper that showed improvement and less complications with the use of compression stockings after sclerotherapy or with Sotrodecol. And Dr. Kern, years after, in C1 patients in the lateral thigh, also found better result and no different in complication rates. So compression stockings were the best after liquid scleral for small veins. But recently, another this one very well designed study, a randomized one with photo documentations, found that even with eccentric compression, there are no difference between the groups with or without compression. So the literature is in conflict. A very recent meta-analysis found in 90 studies that that compression may have positive impact in either in postoperative complications or healing ulcers, and suggests that after sclerotherapy improves the vessel disappearance, and we do have lower side effects. So still, compression stocking is the best. However, if you go deeper in the discussion, you're going to find that compression exerts pressure in the skin and subcutaneous tissue in order to reduce reflux and to prevent thrombus formation. But the required pressure is 70 millimeters of mercury in the calf veins and 40 millimeters of mercury in the thigh. And in the discussion, they say that lower pressures may be required for smaller reticular veins and telangiectasias. This is where I think they're wrong. And I can just show you why. This is a manometer trying to close the telangiectasias. You can see reaching 160, 180, 200 millimeters of mercury, then you're gonna see, still gonna see telangiectasias. So you cannot compress telangiectasias and reticular veins with compression stockings. That's why the level of the evidence to use compression therapy after sclerotherapy is great to see. In the duration of compression, it is only best practice. We don't have support in the medical literature to use compression stockings after sclerotherapy. And I'm going to show you why, because this is the skin, this is subcutaneous. Telangiectasias in the middle of the skin, blue telangiectasias in the transitions of skin and subcutaneous, and the reticular veins in the subcutaneous. When you make pressure with compression stockings, what is happening is just like this. Everything goes down, and there's no compression in the superficial venous system. When you make compression with a cotton ball, then you're gonna ovalize these veins, and the skin also is gonna change a little bit. But when you make tumescent sclerotherapy, this is what happens. You're gonna put liquid, a lot of liquid, in the transition of skin and subcutaneous, and even in the skin, and then you're gonna compress correctly your veins. So there's not we're not sure where it began. Dr. Spitz from Illinois, United States. The there's a publication, no peer-reviewed publication. There's no peer-reviewed publication, but there's a description of tumescent enhanced sclerotherapy. So it is back in 2007. But the first publication is from Dr. Remelet from Switzerland in a technique that he called START technique, sclerotherapy in tumescent anesthesia of reticular veins and telangiectasias. We're not sure where and with who it began. I learned with Dr. Rombush, and I'm pretty sure he can talk much more for you. This is an example how to use tumescent sclerotherapy. Telangiectasias, and we saw that red telangiectasias are not very good to compression. We start with usual sclerotherapy with either polidocanol, sotrodecol. Here in Brazil, we use a lot of dextrose. So the usual sclerotherapy. This is the aspect after sclerotherapy, and you start perform tumescent anesthesia in the subcutaneous, and then after in the skin to have the aspect of peau d'orange, like the orange skin, just the same aspect of orange skin. So I start in the subcutaneous and then reaching also the skin. This is finishing the tumescent right in the skin. You can see right there. To have the orange skin aspect. So this is a small area. And which solution I use? This is the description of the tumescent enhanced sclerotherapy and the START technique. My personal solution is 500 cc of saline together with 5 cc of bicarbonate, 1 ml of epinephrine, and 25 ml of 2% lidocaine. So this is my personal tumescent solution. This is the aspect right after I made just one region. You can see in the center that I made in the periphery, not yet ready. You can see the difference. When I'm performing tumescence in larger areas, I start with a 0.5% lidocaine only in the skin, and then with a bigger needle, I make the puncture in this previous anesthetized skin and make the tumescent solution in the whole area. So this is an example before and after of immediately after tumescent enhanced sclerotherapy. So what I have learned from using this tumescent assisted sclerotherapy, for me, it is the best way to make compression in dermal and subdermal veins. I do have less staining, less ecchymosis, better result. I don't know, but maybe my impression. And my recommendation is to use this technique in this bulged, like this bigger venolactasias, blue telangiectasias, and also in the telangiectasias, the spider veins that is in the middle of the skin, because with that you can compress pretty much better with the tumescent sclerotherapy. This is an example. This patient just came back for her after 2 sessions this week, so I took the pictures to show you how the tumescent sclerotherapy can help you in your practice. So if you did not try yet, You should, because in this kind of veins, we can achieve a very good result with this technique. Thank you very much.